Recording. I'd like to welcome everybody to our webinar for April. Today we've got Dr. Sheila Frankfurt, who will be presenting to us on military-related moral injury experiences of identity-based harm. So Dr. Sheila Frankfurt is a psychologist and investigator at the Department of Veteran Affairs, Vision 17 Center for Excellence, research on returning war veterans in Waco, Texas. Her research focuses on better understanding moral injury, developing a novel group-based therapy for moral injury and suicide prevention initiatives. She's currently supported by a Career Development Award, funded by the Department of Veteran Affairs R&D Service. So today we're going to be talking about moral injury is described as the harm that may result in the events that violate deeply held notions or the right or wrong. Dr. Sheila Frankfurt will present on research data, the clinical and empirical literature on military-related moral injury events and their impact, with particular emphasis on identity-based aspects of moral injury. So Dr. Frankfurt, again, good to see you after such a long time. Thank you again for giving us your time and your expertise. I'm going to go ahead and relinquish the host role to you. Give me 1 second here, and I see you're already able to share your screen. So I think you're all set to go. Thanks for joining us here.
Great. Thanks so much. Thanks so much for having me. It's so nice to see you again. So my talk is on moral injury, and today I was thinking we could have a conversation about the experiences of identity-based harm, or the ways that people's aspects of identity impact and are impacted by moral injury experiences. Let's see. So some acknowledgements. These are my own views. Here's how I think we can spend our time together. So I'll take some time to define moral injury events and moral injury. And then I'd like to spend more of the time talking about sort of identity-based aspects of moral injury-related harm. And I have prepared transcripts from interviews, qualitative interviews that I've been doing with veterans about their moral injury experiences that are in service of preparing a process-focused group therapy for moral injury. But I have some transcripts of veterans speaking about their moral injuries, and I'd like to read them to you and share some of my reaction to that, and use that to also springboard a discussion about people's reactions to these transcripts and people's thoughts about how identity impacts moral injury. So I'm hoping this can be a discussion-oriented seminar. But briefly to start, I think about moral injury using a multidimensional model. Parallel to PTSD, this is an event-based complex trauma syndrome, insofar as that there is a high magnitude extreme event that involves a violation of deeply held notions of right and wrong. That these events, it's the impact of these events that lead to a cascading complex trauma-like syndrome that's marked by shame, rage, guilt, disgust, that can impact people's identity, their way of thinking about right and wrong, their sense of social connectedness, or even a deeper level, their ability to be related to themselves and to other people, deeply held notions of security and trust, and then can often have a corrosive effect on people's sense of existential meaning and bearing. Functionally, this may look like difficulties with work, participation in society, difficulties taking care of yourself, perhaps self-handicapping. And people who describe themselves as morally injured may also meet criteria for PTSD or depression or anxiety. And conceptually, moral injury, intense moral injury may in extremis predict suicide or put you at higher risk of suicide. That's all to say that, this is a working conceptual model, And it's kind of built off of good clinical writing and some empirical research, but certainly this multidimensional model moral injury is nascent, I'd say still. Okay. So I think it's important to point out in the military context the circumstances that moral injury events occur. And here I'm drawing from a really high quality article that Joseph Currier and his team did, where they interviewed 20 some veterans about the circumstances of their moral injury events. So not just what happened, but what do they think contributed to what happened? And I point this out because even though we're talking about moral injury in terms of sort of like the intrapsychic experience of harm, distress, and suffering, that these are contextually based events. So the context is important to be appraised of.
Sheila, I think you may have cut out for the last like 20 or 30 seconds.
Oh, no. Okay.
Yeah, you're good now, but just to let you know, the audience probably didn't hear what you said.
Okay. Can you tell me what's the last thing you heard?
The last thing I heard was that this is a high quality article.
Oh, okay. Thank you. Okay, great. So this is a high quality article that interviewed veterans about what were the circumstances that led to their moral injury events. And I think that that is really relevant because these contexts are the context, even though this is talked about in terms of intrapsychic suffering, so that's people's senses of their emotional responses of guilt and shame and anger, these are responding to circumstances that happen in the world. And when we're talking about military-based events, sort of nothing in the military or in war, is sort of happening in isolation. So these veterans identified sort of these interlocking kind of layers of contributing factors. So there's organizational circumstances that can contribute to moral injury events. That's like the ROE is rules of engagement. So the rules of engagement that dictate when you can and cannot kind of engage in violence. Military leadership, perhaps intelligence or lack of training, can contribute to situations where people feel like they act in ways that violate their sense of right and wrong. There's specific environmental circumstances, like the type of conflict they're engaging in, the chaos and needing to make split-second decisions, cultural and relational circumstances. Now we're starting to get closer to what are the individual's contributing factors, like being in a group and groupthink, not trusting who you're around, maybe civilians that you're working with, having group-based bonds that are straight by acts of violence that may carry people to do things that they wouldn't do in civilian circumstances or other circumstances. And certainly dehumanization of the enemy, both intentional and unintentional by military practices or experiences, contribute to getting people into situations or putting people into situations where they're going to be acting in ways that may violate their sense of right and wrong. And I realize now I'm speaking sort of in circumlocution of what I'm talking about, because I think that in the military-based moral injury events, sort of the prototypical ones involve acts of violence against another person. They could be an act of violence or including killing, but it could also be acts of betrayal. And then there's also psychological circumstances that can lead people to acting in ways or witnessing others acting in ways that violates their sense of right and wrong. That could be hopelessness, or actually coming to learn that you enjoy aggression, or feeling powerful or dominant in some situations. Emotional numbing out, anger and retribution or grief, or even a sense of fear and helplessness. So, I think it's important to keep this in mind that, when you're talking to veterans about sort of what happened and why it happened, that there's all these other contributing factors, even if you may not be hearing them in someone's narrative or in they're telling about it, maybe worth thinking through and trying to listen for, or to be curious about. Okay, so in someone's particular event, sort of what was the organizational circumstances around them during the time of their military service? What were the environmental circumstances? What were their cultural relational circumstances? And then, what you probably end up hearing in a clinical setting is most often about the psychological circumstances, but it may take more directed assessment to try and get at these other spheres of influence. Often a question is like, what's the difference between moral injury and PTSD? And I'd sort of briefly say that I don't have a very satisfying answer. I think it's an open question, and that to my mind, it depends on how you conceptualize moral injury or where you set the boundaries of the moral injury syndrome. To my mind, moral injury is more of an explanation for certain kinds of suffering and harm. It's like an evaluative concept. It says when high magnitude, disturbing, stressful, including life-threatening events happen, and people have the impact of that goes beyond depression or PTSD. It's PTSD plus depression plus substance use or maladaptive to cope, plus it's a sense of sort of severing relatedness, plus it could be because this sort of sense of right and wrong has been so deeply violated that there's almost a characterological impact that goes beyond one, like axis one disorder. But on the other hand, PTSD symptoms cover a lot of what we're talking about moral injury from a descriptive point of view. So, they're not the same, but they aren't mutually exclusive. It may be that they're dimensionally related to one another, and it might be kind of more dependent on where you set the boundaries of moral injury, because we have we have clear-cut criteria for PTSD. Okay. So I'll pause and I can see the chat, and I'm wondering, if people want to put in the chat or volunteer to unmic. What has come to mind when people hear moral injury event or moral injury? What have they worked with, or how do they think about it? Something that has shattered one's moral compass. Mm-hmm. Distinctive losses. Yep, losses. Loss of what comes to your mind? Yeah, a sense of identity or a previous sense of self. Things they did or they feel they should have done or they couldn't prevent. A loss of self, maybe loss of self to guilt and shame, guilt, regret. Yep, administrative betrayal, like having their back supporting them, not having their back. Could also lead to shame, ambiguous loss. Mm-hmm. It's a more, in some ways, it's a more expansive set of disturbing and kind of maybe sort of small t trauma, not capital T like it meets criterion A for PTSD, but certainly kind of in the realm of things that we might consider traumatic, and that it could really profoundly violate or annihilate or collapse your sense of self. That your sense of purpose is gone and meaning is gone, things you've never would do based on your values. Right, so that could be a sense of loss of identity because of what you've done or lived through in a violation of what's right. Not only a conception, but a subjective experience. Yep. The personal meaning of these events and the impact of these events is very important. Yeah, for understanding the harm of it. Maybe that's a good transition to, okay, the loss depends on the type of event. Traumatic in the sense it's very troubling. Yeah. Mm-hmm. Right. So an expansive sense of loss too. Mm-hmm. So what I kind of get the theme coming across is that there's this idea of a loss of sense of self, a loss of sense of goodness of the self. There's that connection to shame. Maybe there's not grief because things haven't been grieved. There's Chaim Shatten wrote about back in the 80s, who was one of the psychiatrists who helped start the rap groups with Vietnam veterans. He wrote that PTSD, wasn't moral injury, is encapsulated grief. So like grief that can't be grieved, or mourning that hasn't happened yet, and how fundamentally kind of destabilizing, disturbing that can be for a person. So what I'm going to bring into the conversation is the idea of identity-based harm. And I've found this definition of identity-based harm actually from a website about education, an educational context, but I think it's a pretty good summary. Targeting a person based on identity markers such as race, color, ethnicity, caste, religion, gender identity, gender expression, sexual identity, national origin, citizenship status, socioeconomic status, age, language, or ability. So targeting on a person based on one of these markers of identity. So a pretty complex construct. Of course, people have multiple aspects of their identity. But I think it's particularly complicated in the moral injury context, because we have to ask ourselves, whose identity are we holding in our minds when we're thinking about identity-based harm? And whose harm are we holding in our minds? I think what is unique about the formulation of the moral injury idea is that to my mind, it's relational in its core, because harm, by and large, involves people, one person doing something to another person, and that involves harm, and it's that relational aspect that makes it so disturbing. And so if it's this relational concept, there are either two people involved in moral injury, the person who has done the wrongdoing and the person who has suffered the wrongdoing. It may be in situations that there truly is two people, or it might be that the other person is imagined or perceived. But even still, there could be the possibility of another person there, either at the other end of the violence, if someone is disturbed by things that they felt that they did, or someone doing the betrayal if they're feeling their senses are morally injured by something that someone else did or an institution did. And I suspect that, yeah, we're both, right? It's going to be important for us to kind of try to think through the identity of different aspects of identity of both the veteran, who we may see in a clinical context, and also the aspects of the identity of the person who's being affected, just whoever is on the other side of this kind of relational equation. There's a question, curious if moral injury could be experienced if considering self-harm. Self-harm like suicide, or like self-injurious thoughts and behaviors? If you could put a little more context in there. Yeah, suicide. That's an interesting thought. I'd ask you and kind of the other audience to hold that in your mind, and let's come back to it towards the end when we have more discussion. Because I don't know, I'm going to have to give that a think. So I saw Dr. Pernicano said military status as aspects of identity. Well, I came up with, what I thought could be aspects of identity that may get implicated or sort of be relevant to understanding people's moral injuries and events. Someone's branch, military branch, and then the unit culture within their branch. So Marines versus armies, and then, one unit versus another unit, even within those branches could have their own culture. Someone's rank, if you're an NCO or enlisted versus an officer. Simply maybe your veteran status, and if it's the kind of discharge you have, your gender identity, your age, both in terms of, in kind of in multiple ways, where you are in the developmental course of your life. Are you a young person? Are you middle-aged? Are you an older adult? Are you in your senescence? But also then in terms of what were you likely to have experienced in the military based on the era that you were serving and, what kind of conflicts were going on. Your race and your ethnicity, your sexuality, your religiosity and spirituality, what significant developmental experiences or events you had in your life, person specific. Another way of thinking that would be like what, maybe it would be adverse childhood events that could impact and help shape your coping style or your attachment style that you develop later in life, and thus how you both make sense of and deal with the impact of moral injury events. Your political or your ideological commitments can be a close and important held part of someone's identity that would shape the events of their impact. Personality, character traits, sociocultural experiences, sort of important shared cultural experiences. I mean, one that comes to mind is sort of the maybe the difference between Vietnam veterans' experiences of cynicism and a sense of cynicism and betrayal by the larger public when they came home from service versus later deployments where there's a much stronger emphasis on thanking people for their service. And I imagine that would shape someone's experiences as well. So what I'm thinking is that I can share some interview transcripts. And so these are interviews that I did with semi-structured interviews with veterans who describe themselves as morally injured. So they had to say that they had to endorse having an experience that either they, something that they did or failed to do or witnessed or experienced as a betrayal and were functionally impaired as part of these experiences. And I invited them to participate in a study to give their feedback on how to develop a process-focused group therapy that I'm developing with Dr. Carter Jump. And as part of those interviews, though, I asked them about their moral injury events and the impact of them. And I was asked them to also specifically whether they involved any racialized, sexualized, or gender-based transgressions. And so I want to put out there that these aspects of identity, are not exhaustive, and they're not the only ones that I'm interested in. Certainly the previous slide had a lot more, but when Dr. Carter Jump and I ran a moral injury therapy group, veterans would allude to racialized and sexualized aspects of their moral injury. And I wanted to hear specifically from veterans who weren't in the therapy group, whether they also experienced these moral injuries within this framework. And so then they were also asked to describe the impact of these events. Okay, so as I'm listening, I'd like you to ask, kind of think about what was it like to listen to these interviews? Kind of what aspects of identity did you hear when you were listening and what came to mind? I'd invite you to put your responses in the chat as I'm reading, and then we can talk about it as a group afterwards. Okay. So the first interview I'll share is with a man that I'll call Gabriel, and he's a white Latino man in his late 30s. He's divorced and he wasn't working at the time of the interview while he recovered from surgery. He'd been in the Army the Army Reserves for about 10 years and had served one tour in Afghanistan in the late 2000s. So his original job was a chemical weapons specialist, but in Afghanistan, he was an officer's bodyguard. During our study screening procedures, he reported being troubled by an event that involved observing or being directly impacted by someone else's actions that violated a sense of wrong. He described a high level of functional impairment, and then he also screened positive for PTSD. So after completing the screening interview, he and I spoke for about an hour via video conference. He was at home, casually dressed, drinking a 32-ounce energy drink. When he asked him about his current functioning, he said, yeah, oh, I'm okay. I'm not able to work. I got injured, but I'm recovering from that. I asked him how surgery was going. He said, pretty good. And that was sort of it. So I bridged to the first question about his military experiences. I'm going to ask you a few questions about your moral injuries and how they've impacted you. And then we'll turn our attention to what it's been like living with these experiences and how therapy may go. Can you give us a broad outline of the events? And he said, okay, well, can you be more specific about what you're asking about? Because I mentioned a couple. I said, okay, please just start where your mind goes. And we can talk about as many or as few as you want. At this point, he starts to talk kind of rangingly with some distractedness about a number of different moral injury experiences. I'm just going to share a couple that he shared with me. At one point, he laughed himself. He says, then there was, how I was explaining how we use our vehicles to deter other vehicles? One of the guys on the team, he was a shorter guy. Just thinking about him makes me laugh. There was an area where he thought it was a great idea to pull out his pistol and point it at the vehicles behind him. But he didn't know we were about to make a turn, and we were going fast speed, 40 to 50 miles per hour, and the door was open, and he tumbled out in the middle of the road. He broke his femur, and his immediate reaction was to point his pistol at the vehicles coming at him. I still make fun of him today. And I asked, so he survived? And he said, yeah. He gave the name. He said, and then I guess I'll go with the main one that affected me. It was, like I said, we would take our bosses wherever we wanted to go. Well, there was this one colonel, not one of the guys we usually take care of. He just requested that our bosses, that he could use our team. And he wanted to go to a shooting range, just, pop off some rounds. And there was a team that went, and what did I do that day? There was a control room where someone's always manning it just in case. And I believe I had the control room that day. So they go on their mission. I'm in the control room and we get a phone call. I get a phone call and that just said, we're under attack and there's possibly 1-2 KIA. And I was like, is this a joke? That was the first thing that came to mind. Are you fucking around with me? That's what I said. Are you fucking around with me? And he said, no, we just got attacked. He goes on to describe some really eerie experiences in the aftermath of this, learning about this death, who happened to be his roommate during and after his funeral. I asked him, I said, well, what's it like to talk about this now? And he said, well, I guess because of my medication that I'm taking, it's a little easier to talk about it. But before, I would get instantly angry about it. That was my reaction when I had to talk about it, for the same reason, because for the same reason, that was a mission that never needed to take place to begin with. At the end of the interview, after talking more about the therapy, I asked him what it had been like to talk about all of this today to do the interview. And he said, like I said, with the medication I'm on, it's a little easier. Plus, it's been about 15 years since it happened. But the bad thing is I can still see everything like if it just recently happened. Ask me about what happened yesterday. I don't know, but ask me about this stuff. I can elaborate a little bit. The second interview I'll share, it was with another man I'll call Gabriel because he actually does have the same first name as the first veteran. And he's a white Latino man in his early 40s, divorced with a few kids, 100% service connected for disability, including PTSD, and working part-time. He discharged as a sergeant in the Marines and had served 2 tours in Iraq as a machine gunner and an equipment specialist. During the pre-interview assessment, he had reported being troubled by things he had done, had failed to do, and things he had witnessed. And he had reported high functional impairment secondary to those events and screened positive for PTSD. So we had spoken over teleconference, and most of his body was visible, like he was leaning forward over his laptop, and a tidy and impersonal kitchen was visible behind him. He said, how am I doing? How? Well, I'm okay. Unfortunately, yesterday is the 9th anniversary of one of my friends getting killed in Iraq in 2009. So I was kind of down. I didn't feel like doing much yesterday, even if it's been that long of a time. And it kind of snuck up on me, but nothing too serious. It's kind of par for the course. It's been this way this time of the year. I said, because of the death of your friend? He said, there's one each month, January, February, March, these consecutive months. I tend to be more down than usual. I asked him if he could tell me something about his moral injury events, about these events or what they were like or their impact. I think there's a few instances with regard to feeling adversely to different events. There's a lot of shame and guilt and second guessing. There's a lot of guilt with regard to, while I was there were definitely instances where, for instance, I would pray to God, hey, get me out of here and get me back home. And, I'll go to church every Sunday and live my life to the fullest for all my friends who died. And I feel great guilt and shame because I don't feel like I'm fulfilling up to that, at least in that regard. We were put in difficult situations. There were instances where we were, we put fire on a family, unfortunately, in a vehicle with kids. Semi trucks with guys, with nothing in them. The semi trucks, it's really tricky because there are barriers and signs to say, slow down, slow down, slow down. And they didn't. They didn't see them or choose to ignore them or whatever the case may be. And our rules of engagement were to open fire. And unfortunately, in the aftermath, you find out there were kids that were no longer there, or they're there, but they're no longer alive. But coming upon that, without a doubt. In the moment, there wasn't a lot of it. There was some, oh shit, that wasn't good, knowing right from wrong. But in the moment, you're working at an operational level. I know, shove it to the back of your head. We got to keep going. You got to keep going. Unfortunate incident. But Marine mentality at the time is, that's not my fucking problem. However, what we're looking at 15 years later, you still get sick to your stomach thinking, was that really necessary? Should I have done something differently? Should we do something differently? I said, who's we? I said, fellow Marines, but not just at that level, but at a higher level. Should that be what was sent down at the time for the situation? So, it's gotten a lot better, but at times I spent a lot of time playing the what if game. And I know it's a dangerous game and I've gotten better. Thoughts these days are more fleeting than swelling. They might be more present now during these months. For instance, the gentleman that was killed yesterday, it was a checkpoint and the Iraqis didn't acknowledge the road stop signs and ran right through them and actually ran into the vehicle that killed him. And, should we have shot sooner? Should we have put that vehicle in a different place? Would he still be here with us? A lot of things like that. I asked, did those events involve race or racial violence? And he said, like within the Marines or within the people around me or with Iraqis being a race? I said, any or all, I guess. I'm wondering about it from your perspective. He said, yeah, within the Marine Corps, no. I would think absolutely you grow. Me personally, I became pretty disgusted by their ways, their values, how they treat women. The men just So I think what it starts out with me was, hey, this is unusual. This is what I'm used to. So I don't really like this. I don't really like these people. And eventually it turns into a race, full-fledged racism towards those individuals. That doesn't mean there wasn't sympathy at times for women and children, but I think it was pretty safe to say that even though we were there to help Iraqis, pretty much by the end of the tour, yeah, it was pretty much prejudice, racism towards them, without a doubt. I think it comes and goes, fluctuates intensities depending on the situations. Something happens, an incident goes on, whether a Marine runs over a mine, and then that disdain goes high, rather than when nothing happens. Situation dictates. I asked him, did those events involve sexual harm in some form, physical or verbal? And he said, no, not at all. Not in my experience, no. And actually later in the interview, he went on to describe his growing awareness of sexual harm when he worked at a VSO, helping people helping veterans process their claims, and became aware of perhaps there could be moral injury related to sexual violence, but he was very certain that he didn't see anything like that his tour. Okay. I'm not seeing comments, so I think I'll go on with the third interview. So the third interview I'll present is with a former member of this ad hoc group therapy that I co-led at the VA clinic with Dr. Carter Fisher Jump. So I'm going to call him Louis. Louis is a middle-aged married white Latino man who retired from the Navy after serving 20 years as a medic. He deployed during the first Gulf War and the Iraq War. And during the interview, pre-interview assessment, he reported being troubled by an event that involved observing someone acting in a way that went against his values. And he reported high functional impairment to that event and endorsed all the items of the PTSD screener. So we spoke over telephone because he preferred not to speak over teleconference. And when I asked him about his current functioning, he said, I would say things haven't really changed that much since I left the military, since we had that group. I'm still having quite a bit of anxiety at times and having problems sleeping and things like that. I'm having a very hard time adjusting to things in general. Nothing I can put my finger on, just, well, ever since the COVID thing started, that made things harder. You know, I was talking a while with, can't remember his name, and I volunteered his former therapist's name. I was talking with him, but after a while, I guess he stopped calling and he just stopped making, we were talking over the phone, but maybe he was getting more patience in person. He stopped calling. Not sure why it stopped. So I bridged to the first question about his haunting military experiences and asked him to give the broad outlines of the event. So, yeah, it was quite a few different events over the span of 8 years. I had deployed 4 times over 8 years, so it was almost every other year, maybe over 9 years. But it started in 2004 during the first Battle of Fallujah when one of the units we were taking over for, they were about to be rotated out. And there were only a few days before they were ready to leave. And several of their guys got killed in a rocket attack, and I was there to respond to it as it happened, right when it happened. So it had a big impact on me personally. A lot of it had to do with the timing of everything and the circumstances of what happened. Other different similar events in subsequent deployments also like that. I think it was just for me, the volume of the casualties and dealing with the children. That was all basically kinetic damage to the body. And I asked him, did the events involve anything like racial harm or violence? He said, no, nothing to do with anything like that. Why would you ask? So I was really struck that, you know, when Louis, he had this remote and hollowed way of talking. You know, to me, he sounded like there was a big chasm between his voice and his mind, and like his mind was way back in his head and was sort of hardly reaching out. You know, during the interview when he discussed his events, he took a few moments to find his words, you know, to stop talking, and there were a lot of pauses. But unlike the sort of sense of eeriness and mystery I felt speaking when I was listening to the Gabriel, the first person I shared with you, I had really vivid images in my mind listening to Louis about like a hospital being blown up and him being 50 yards away or so and being knocked down, and then going to the entrance that was blown open and sorting through the rubble and the debris. You know, and I think I first got this really vivid image when he recalled this event during group therapy, but I don't actually think he was much more descriptive than he was here. But he also had never talked about children before in the group. And then in response to the question about whether his haunting military event involved racialized violence, he really sounded kind of taken aback when he said, I don't see how it would. And actually at the time, I thought something along the lines of, like, so you didn't see all the killing of Iraqi people as racialized violence? But when he answered the question about sexual harm, no, this was basically kinetic damage to the body, nothing to do with anything like that. I began to wonder about his negatives. I wondered, does that mean he didn't encounter anything like that? No racialized or sexualized violence? Because I found that hard to believe on face value. Or that he's solely focused on events that involve terrible harm to people. But I also wonder whether there's something about the way he says, this is just kinetic damage to the body, actually also strips some of the meaning and the context, any of the relationality or humanity out of it. And that missing larger context isn't actually a sign of the collapsed self. That's a phrase from Gisèle Boulanger about how the effect of trauma can kind of collapse the self from under the weight of overwhelming affect. Okay. So this fourth interview I'll share, I think I'll share it, and hopefully we'll have some more time. The fourth interview was someone I'll call Salamao. He's a retired married septuagenarian Mexican-American man who served 2 tours in Vietnam and the Marines in active combat. And Salamao had been in the same therapy cohort group as Lewis. And then I saw him for individual telephone therapy for 6 or 7 months during the beginning of the pandemic. And I hadn't spoken to him for about a year prior to the interview. And in the interim, he had transitioned his care to the vet center. During the pre-interview assessment, he'd reported haunting military events that involved things he had done, what others had done, what he'd seen others do. But he reported being most directly impacted by someone else's actions. So he's a pretty circumlocutus and expansive talker. So when I asked him about his moral injury events, and he started to say for a while. But the moral injury group, now talking about the therapy group, came, and it was something different. And it gave me an outlook that let me see things that I had covered up. And almost like I compare it with a woman soldier or a lady soldier. And I have the utmost respect for lady soldiers and nurses, because when I went to triage, when I got wounded, what they did, 3 Marines gave their lives for me. I feel for me, and another 11 were wounded. But when I got to triage and how calmly and professionally they attended to us and cut our clothes open, and I could hear, and even though I wasn't in pain because I was on morphine, but what they, after they left, how they were our mothers or wives, our girlfriends, our sisters. It's really humbling to see that. And moral injury, I see how women have always been taken advantage of, and things they could say, that they could say. And moral injury for me, it's how they couldn't express anything. And for me, it's still machismo and taking advantage of lady soldiers. And moral injury is some things that I looked up to, how I wanted to be, and my impression, feeling so vain at 18 years old. Anyone being in Vietnam longer than me, I respected. But when I saw how they took advantage of people, I didn't know what to expect. He went on to say, my MOS was machine gunner. When we first went out, I had an M16, and the first time I went out, no one showed me what to do. And I had to go on to patrol, and they handed me an M17, and I had the ammo, but I didn't know what to do. My first skirmish, it's like 10 minutes, 5 minutes, and it just takes a little while, but it's not a main firefighter, an ambush. And at one point, once I had survived certain things and how I reacted, but I didn't realize that people were carrying ammunition for me because they knew I would use the ammo. I had people carrying for me, but I carried my own ammo because mine was belt fed. People I was looking up to, I realized that in certain areas, in certain places, you're in Waco, he's saying me, you're in Waco, and where Belton is 45 minutes away. You're settled in a town 30 minutes away. You're in the bush, and you're settled, and then you're rotated. And then some people are there 3 or 6 months. I never saw people complete a tour but I was only there for 4 months before I got wounded. But there were people taking advantage of women, even if they were old, and they challenged me. And I was Catholic, and I didn't know that war was war, and I didn't know that there was going to be a dirtiness to it. And I had a lot of anger, and we'd lose people, and we'd retaliate by seeing people at certain areas. And I'd see Marines take lives. But the end product is that wherever we go again, it's like you go to temple and you keep going to temple and people know you. So when you rotate and there are different units taking your place, but when you rotate and people know you and retaliate and people do things like raping women, and I had to see, was I going to be like that? And I had to see, I wanted to be like that. And at this point, he becomes tearing up, and I felt affectively charged with sadness and tension and worry. And the difference is something we don't speak about. So moral injury is a side, a dirty side we don't speak about, not the traumatic side. That was less than losing friends and brothers, but still nothing that I thought of. And then he goes on to speak about his experiences as a sheltered young Mexican-American man from a Spanish-speaking ethnic enclave in Texas, and then encountering interpersonal racism for the first time when he was in Vietnam, and he became disillusioned and embittered by it. So when he started talking about taking advantage of lady soldiers, I remember I sort of sat up in my chair a little because he hadn't talked about anything like that before, even in the group. And I remember thinking like, oh, is he going to allude to or talk about sexual violence? You know, because in fact, in all the groups I'd run, no one had brought that up, I think for a number of reasons, but I was almost conspicuous for its absence in the therapy groups I ran. So I'll kind of leave the talk off here. We only have a couple more minutes, but I think there's like a lot to listen to from these different veterans talking about their haunting military expenses. And there's a lot of different aspects of identity. You know, I'll pause here, and I'm wondering if people want to talk about their responses or what they hear, what it was like to listen to these interviews.
And Sheila, there were a couple of questions in the Q&A feature, which you may not be able to see, but Gilbert Sanders asks, all three examples were Hispanic. From your experience, are there more moral injuries in Hispanics versus non-Hispanics? And could this be based on views on religion or faith?
Oh, that's an interesting question. Yeah, I'm gonna hold off on attributing the answer, the response to the Hispanic necessarily, because in Texas where I'm at, there's a lot of Hispanic or Latino, Latinx veterans, and it so happened that, you know, through recruitment, that most of these men ended up being Latino. So I guess I'm kind of more interested in sort of, I guess, also kind of drilling down, you know, kind of into what aspects of that sort of expansive, incredibly expansive category would be, could be heightened moral injury. So yeah.
Right. Yeah, it's an interesting question. I think it kind of highlights, you know, if we were to, for a moment, right, put the Hispanic population aside, do you see more moral injury in individuals that kind of note higher, you know, religious, spiritual, faith-based beliefs?
Yeah, that I'm going to give another unsatisfying punt, because I think that I don't know. I think it would be dimensional. My guess is it would be dimensional how it appears if someone has strong, a sort of a strong specific religious commitment. It would shape the form of their moral injury, and it might look different than someone who has a non-religious humanistic commitment to other people, or to sort of a sense of goodness. And so then the sort of the form and the content of it might look very different, but is that actually then one kind of harder to live with or the other? I would suspect not. Once again, that would be more about kind of each individual person, sort of this going through all the kind of different aspects of someone's identity and their experiences and the impact, versus attributing it more broadly.
And I see Carter wants to chime in. So Carter, check. I'm going to unmute you, so feel free to let us know what's on your mind.
Yeah, I was going to ask, did you notice through all of your interviews that there was possibly a lack of recognition of the good that's within them? Why they're experiencing this moral pain is that's actually the good part of them. It seemed that in the stories you shared, there wasn't that recognition.
Mm-hmm. Yeah, I'd say so. I think so. And it could be because I'm in both the therapy group was inviting people who were suffering to talk about their suffering, and in the way that I identified people for these interviews, I was asking for people who were sort of like actively morally injured. And I imagine that a sign and symptom of moral injury is not having a sense of oneself as having any goodness. And maybe that's sort of, if you kind of think of the severity rate, sort of the less in contact you can be with any part of of yourself that's good, sort of the worse off you are. And that's kind of who I was looking to. It's kind of who's really struggling that might be in this therapy group. So I don't know that that's necessarily representative of moral injury, as it could be because of the people that I was talking to. Yeah, but I picked that up too.
I'm just conscious of time. So Dr. Frankfurt, I know we've got about a minute and we're going to do some general announcements here at the end, but wanted to see any closing thoughts, anything that you would want the group to kind of leave with today as you kind of wrap up your discussion. And thank you again for sharing your interviews and your expertise.
I appreciate people's participation and sharing their thoughts. And, if people have thoughts, I'd actually really invite you to email me or to get in touch, because I'm interested in learning from clinicians and their experiences. There's a lot to kind of sort out and figure out about this, how to think about and how to treat this. It's certainly not a closed book right now.
Right. Well, thank you again, Dr. Frankfurt, for sharing your work and your clinical experience. I think it really generated a lot of interesting questions and gave us a lot to really think about as we kind of work with folks in this space with these significant events in their lives. Jeremy, did you want to do a quick announcement about what do we have in the lineup here over the next month or so for future webinars?
Yeah, not a problem. So starting next month, we have our first part of the advocacy series on May 1st, which is a Monday at 12 p.m. Central. And that is Psychologists as Agents of Change, Navigating Hospital-Wide Changes for Trans-Identified and Gender-Diverse Individuals. We will have a subsequent advocacy series part 2 that's getting planned currently in June. And in July, we'll have the third part of this. In July, we also have 2 presentations, so be on the lookout for us. We're trying to keep super busy, but we will have on July 3rd a presentation on SMI and PTSD, and then we'll also have the third part of our advocacy series, I believe, on the 14th.
Great. Yeah. So busy time. We really look forward to sending out more information about a Psychologist of Change advocacy series over the next 3 months or so. So keep an eye out on that. And again, as always, thank you all for joining and for supporting our monthly webinar series. Hopefully we'll get to see you again here next time. So thank you again for joining.